Welcome my friends to my channel. I'm Bob Schrupp, physical therapist, providing you with physical therapy treatments that you can do yourself in your own home, which is pretty cool. First off, congratulations must be in order because you're watching this video, which means that you probably have had a knee replacement. And specifically today what we're going to talk about is how to help straighten that leg, straighten that knee after you've had a knee replacement. And this is very critical, of course, because you don't want to have that limp when you're walking, and if you don't get the knee virtually straight, you're going to have a bit of a limp. So let's first show, I want to show you exactly what the leg should look like when it's all said and done, so that you know that you have it straightened far enough. This is just a simple thing that we show all of our patients. So this is going to be the leg that actually you had the knee replacement performed on, and this is your regular leg. Now if this is a good knee with no problems, when you put it up on a stool, it should straighten completely. Now if it's an arthritic knee and it doesn't straighten all completely, this isn't going to work. But you should be able to put this leg up on top of the stool also, and they should be level. As you can see right now, this one's too high. Now it's level. That's where you want it to be. You want it to be completely straight, level with the other knee. So how are we going to get there? The first stretch that we show people is a very simple one. You're going to have a chair, you're going to have a stool, or you're going to have another chair. And I want a straight back chair. I don't want you in a recliner, because we're trying to stretch the hamstrings here too, and I'll show you in a minute what that means. So you're going to put your foot up on the stool, and basically you're going to let gravity do its thing. You're going to let gravity push it down. And I'd like to see you do this for 5 minutes. Now let's say you have trouble tolerating this. It's like, oh my God, that hurts too much. Do it for a few seconds, and then go ahead and bend your knee and give yourself some relief. Then go back and do it again. But we have our patients do this at least 3 times a day for 5 minutes if they can tolerate it. Now the reason that you don't want to be in a chair that's not straight back is if you're doing a hamstring stretch, what you are going to do is you're going to actually lean forward like this, and then it really pulls. If you lean back, which you do in a recliner, or if your chair wasn't a straight back chair, it actually takes stress off the hamstrings. And we do want to stretch the hamstrings, but we're also trying to stretch the joint of the knee. So let's say this gets too easy, or let's say you kind of get bogged down here and it's at a certain bend and it won't straighten anymore. Well, now it's time to put a little weight on there. And by the way, make sure you're getting all of these approved by your physical therapist or doctor. I don't want you going off willy-nilly and trying this on your own. All right, this is what we call the weighted pillow. I can't even say it. Weighted pillow. What I've done is I've taken soup cans and I put them in my pillow here. And you can line them up on the sides. They've actually kind of fallen through to the bottom right now. But you're going to start off with just a couple cans, maybe 1 can. And you're going to put your leg up here and you're actually going to put these on top of your knee. And this is going to give you a little more stretch, obviously. This one's a fairly heavy one. I got a lot of cans in there right now. So the weighted pillow, I can finally say it now. And again, you're going to put it on there, and that's going to give a little more stretch to it. And if that's too much again, move the pillow off for a second, bend the knee, and then go back into it again. The weighted pillow works really well. Okay, in this instance you're going to be on your bed and you're going to have a rolled bolster here. This is what I did, is I just took 2 towels and rolled them up to make a big round bolster. Because what you're going to want to do is you're going to lay down flat on your back with your knee replacement leg up on the bolster like this. And it's going to be a little bit bent, isn't it? Because it's not straight yet. And you're just going to lay back like this, and you're going to let gravity, you're going to actually try to help push it down. The way to make this even better though is to take that weighted pillow again. And here's the pillow. Again, I have it stuffed full of cans. And you're going to take your weighted pillow and you're going to have to decide how much weight you can tolerate. But I got the cans on there. I got quite a few. This is probably 10 pounds. And now the weight of the pillow is helping push the knee down straight. Again, if this is too much to tolerate, bend the knee for a while, give it a little bit of rest. Take the weight off for a while, give it a little bit of rest. In this instance now, we're not stretching the hamstring muscles. Therefore, we're just trying to work on straightening the joint and get that to straighten all the way down. But again, the key is to lay on your back, take your weighted pillow, put it on there, give it a little weight, a little stretch, a little additional stretch. And what's cool about the weighted pillow is you can determine how heavy it's going to be. The number of cans you put in there, the more cans, the heavier it's going to be.